CDK4/6 inhibitors now are approved for both second and first-line endocrine therapy in patients that have tumors that are ER or PR positive and HER2 negative. They roughly double progression-free survival in either line of therapy, and so they are now recommended by ASCO and NCCN guidelines in combination with aromatase inhibitors in the first line, or with fulvestrant in either first or second line, ribociclib specifically in first line with fulvestrant. And it's also okay and permissible to use endocrine therapy alone, because up until this point, the difference has been mostly in progression-free survival, but not in overall survival. And typically these drugs are pretty well tolerated. Neutropenia is the most common side effect, and with abemaciclib there's less neutropenia but more GI side effects. Now, the areas in which they are being looked at in the future are going to be in the early stage setting. So adjuvant trials are now underway with each of the 3 approved drugs, palbociclib, ribociclib, and abemaciclib, in higher risk individuals for either 2 or 3 years, depending on the study. So that is another area where we hope to see advances. If we can prevent recurrences in the first place, obviously that's where we want to use the drugs. And we have much to learn about why patients become resistant, which subsets may benefit. So there's a lot of work ongoing in that area as well.